The staff and doctor were phenomenal. It's a wonderful place to visit.
The quote they gave me in California was something like $20,000. It was just way too much for me. I would have been saddled for debt for decades, potentially. And it ended up being closer to $7,000. So it was way cheaper than anything I could get in the States. The office space was huge, so there wasn't that much of a wait time.
Our CEO, Deepak Datta, visited this clinic himself to see what makes it so popular with patients from around the world.
So here's the front desk. This is the first contact that the patient has with the clinic. This is where they inquire about their appointment, their schedule, the time that they're going to be attended at. And here's the information office, in which they inquire about their treatment or any questions or doubts they might have about their following treatment, place in general, etc. So over here, we've got the general waiting room, which is where patients wait to be called in for the doctor's office. So here's the billing area in which patients pay for their treatment as per financing options, etc., the methods that they're going to pay with. Here's the information room in which patients ask or inquire about a more in-depth explanation about how their treatment plan is going to pay out regarding any billings, regarding any payments, regarding what they have to pay for their first visit, their second visit, etc. From here to the end of the hallway is where we have our dental offices, or dental rooms, in which dentists work at their very best to give you the best dental experience in Mexico. From here to there, we've got the rest of our offices in which laser dentistry is performed, laser-assisted dentistry, or any treatments or procedures that require the use of laser dentistry equipment. Right here, we've got our diagnostic section. This is where patients are called in to have a more in-depth explanation about their treatment. Over here, we've got our CT scan machines in which patients are given a more of a panoramic image or panoramic view of their face, their jaw, their teeth in general. Once the patients have their images taken, they wait over here to be called in by one of our diagnostic doctors, in which a more in-depth explanation about their treatment is given to them. They explain what they're going to do. They give them more of a exact or precise explanation of how to follow up with their treatment. After they've been through diagnostics, patients come to this room to wait to be called in by the doctor.
Here, it's our new office, it's our new building, and this is where we do all the prosthetic parts for our dental clinics. Here in Los Algodones. Like a reception area, there are a few here we hold the communication among the clinics and the lab. And then the whole area, it's divided on different specific parts of the process. So here we have pretty much the final part. We have when we put on our porcelain, when we do all the makeup on the aesthetic part of the prosthetic piece. We have a closed area that is the ovens. So here we have the ovens or the porcelain. We have the ovens for zirconia. So this is pretty much just the area for finishing that part. And here we have our digital latte equipment. So it's a CAD-CAM equipment. So here is our CAD-CAM equipment. Our technicians do the designing. He's actually one of our designers. And so as you can see, he's actually designing right now. He does the design, he does the prosthetic part in the computer. So we can receive here the information in two different ways. One way is that if the patient for some reason cannot have an intraoral scanner, we do the regular impression and they scan it right here. Most of our patients right now receive an intraoral scanner and they receive the scan right away. And they start working on the sign and then they send it to the equipment to be mailed. So this are two different equipments that we have. As you can see, this one is actually working right now. We can do like the full zirconium crowns. We can do full zirconium plates. yeah, these are different kinds of ovens that we have. For example, these ovens are for zirconium. All of these are for zirconium. We do here the sinterization process that we have at the end of the crowns or at the end of the plates. So the zirconium, when you mile it, is not as strong as when it's absolutely finished. To be as strong and to be as translucent or aesthetic, you need to oven it. So you pretty much, but here it's a long process. It can be here for up to 8 hours, depending on the size of the piece and the kind of oven that you have. So our design team, what they do is they do the designing for the crowns to be miled, to the cat kind of equipment, but they also do the models. So the models are 3D printed. So here they finish some models, or they can help it with design for printing. And this is the printing area right here. But this is the printing area. We have different kinds of printers. We have different materials to print with. And what we do is that we have selected equipment specifically for different kinds of material. So let's say that we want to print something like this. This is a model. This is like to fit on a patient, and it's like a full implant supporter, as you can see. So this is like a test model for the patient. This one is printed in one of this. These are 4 models. This one we use for printing surgical guides for implants. And this one we use to print final plates for patients. Instead of using acrylic right now, like the regular acrylic, you use resin and you print them right here. Okay, so this is the most traditional part of the lab. This is where, for one of the most traditional parts, we do acrylic here. So these are the experts that do all the plates, the final plates, or when it's acrylic or temporary plates in acrylic as well. We have a special room to do all the melting, and we do all the heavy work there, and they do the aesthetic part, the artisan work here.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.